Hello and welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center reporting for the week of July 12th. My special guest today is Analena Hassberg from Streetwyze. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Update on the worldwide situation with COVID-19 is that, as you can see here, cases are swinging up. The gray bars represent daily cases, and the blue line represents the 7-day moving average. And I think you can see very clearly here that COVID cases, even this far into the pandemic, are back on the rise. We are seeing spikes in countries all over the world, and sadly, there are over 4 million recorded deaths from COVID-19, and by just about all accounts, this is an underestimate of the actual death toll of COVID-19 so far. In Africa, unfortunately, they are experiencing spikes. The week ending July 4th, there were over 251,000 new COVID-19 cases recorded on the continent. This represents a 20% increase over the week prior to that. And this is actually 12% higher than the continent's previous peak, which was in January, like most of us. Many experts are concerned that, particularly given the fact that under 2% of Africa's population is vaccinated, that the surge in Africa could be worse than anything we've seen across the world, yet even worse than what was seen recently in India. So we will be keeping an eye on that and certainly hopeful that things do not go in that direction. The increasing cases across the world are reportedly causing hospitals in many countries to be under stress, some of them under unprecedented stress, and there have been oxygen shortages reported in not only parts of Africa, but also in parts of Asia and Latin America. And by way of review, the 4 factors that are driving increased spread. First off, we have a virus that is already very contagious, but it is also mutating. And we know that the variants, particularly the Delta variant, is increasingly taking hold, and that with all of this replication, new mutations will continue to emerge. And even the Delta variant itself is mutating. You may have heard of the Delta Plus variant. So the virus itself and its mutations are certainly driving increased spread, but also the reduced public health measures, which we are seeing really across the world. The masking guidelines have been relaxed, the distancing guidelines, the indoor occupancy guidelines. These things have been reduced across the world, and we know that this is contributing to those increased cases. Along the same lines, increased mixing. We have folks traveling all over the world. We have large-scale events occurring, and we know that with increased mixing, there is increased transmission. And again, with increased transmission, we get increased mutations. And mutations become more and more fit, and that is what we are concerned about with the variants. And last but definitely not least, this is a major factor, is the uneven vaccine distribution across the world, in particular with some parts of the world not having even seen vaccinations yet, or having very, very poor access to vaccines and low vaccination rate because of they are poor countries that do not produce their own vaccines, and this is a lot of the talk at the worldwide level is about what they're calling vaccine nationalism, where some countries have more vaccine than they can use and other countries cannot get their hands on it. And uneven vaccine distribution is not only about poorer countries, it is also, when you look across the United States, you can see that we have uneven vaccination rates. And this is due to a variety of factors, but some parts of the country are far less vaccinated than others. And those are the areas that we are also seeing spikes in cases in different parts of the country. So the lifting of restrictions really makes it so that our individual risk management and risk assessment becomes even more important than before. We can no longer rely on the public health measures that are being taken by others around us. And so each one of us, it's even more important that we do our own adequate risk assessment. You should know what the cases are like in your area. Are they increasing? Do we have variants that are more contagious? And know that if you are unvaccinated, you remain vulnerable. And we know it only takes one exposure to get infected. And now that we have even more transmissible varieties, it takes even less time and less of a viral load or exposure to actually get infected. And so without that vaccine protection, you are really rolling the dice with COVID. And remember that COVID has always been unpredictable. It can affect just about any organ in the body. It can cause death and hospitalization, and of all ages. Of course, yes, we know it's more in the older age groups. However, we are seeing fairly consistently now that younger people are becoming hospitalized as well. Now, we know that if you're vaccinated, there still is a small risk that you can contract COVID-19. No vaccine is 100%, but the risk that you will go to the hospital or die are dramatically diminished post vaccination. In fact, we are consistently seeing data from across the country that under 1% of deaths from COVID-19 are now among vaccinated individuals. Again, no vaccine being 100% perfect, we are seeing that the real world data is bearing out exactly in what we saw in the very large clinical trials. And so now I think we can say that COVID-19 illness is vaccine preventable. So that just makes it that much more devastating to know that people are still dying from this virus, and they are. Worldwide, about 8,000 people are still dying per day from COVID-19. And although here in the United States, deaths have come down significantly, people are still dying. We're at the rate of about 225 people per day here in the United States, but with cases rising in many states, including right here in California, with cases ticking up as they are, we know that that means increased hospitalizations and increased deaths. And we know that this virus will continue to look for available hosts. That means the remaining unvaccinated. So, given that we are still far from community immunity and the risk of hospitalization and death are dramatically diminished with the vaccine, who we are worried about right now are the remaining unvaccinated. And this, of course, includes everyone under 12 years old and everyone who has not yet received the vaccine. And there are many experts that believe, and I think this is very reasonable to believe, that given where we find ourselves currently, given how transmissible this thing is, and increasingly so, and that community immunity is still a ways away, you are either going to get the vaccine or you are going to get the virus. And so that's quite a gamble to take. And it's unclear why one would choose to take that gamble at this point when we know that this is a vaccine preventable illness. And I just think about something like tetanus. You step on a nail, and what if someone just steps on a nail and then just decides to go ahead and wait it out and just die from tetanus? I think we would all say, oh my goodness, that is so tragic. This person could have just gotten the tetanus vaccine and not died from tetanus. And so this is really sort of the situation we're in now, where everyone who dies from COVID-19 who had access to the vaccine and chose not to, we feel that that was a preventable situation, and each one is a tragedy. We should not have to lose anyone else to COVID-19. Here in Alameda County, we have had 91,197 COVID-19 cases and 1,270 COVID-19 deaths. We are just above 82% of all those 12 and up who have gotten at least one dose of the vaccine, and almost 70% of 12 and up being fully vaccinated. So these are excellent vaccination rates. They're not going up at quite the rate that we would hope. They're up about 2 percentage points since I last reported about 2 weeks ago. Oakland is not far behind with 80% having had at least one dose and 66% being fully vaccinated. So things are going up, but rather slowly at this point. What is going up, unfortunately, more sharply is our test positivity rates and case rates. So as you can see here, case rates are going up pretty steeply there. And in the lower graph, you can see daily case rates, which are also heading right up in the wrong direction. And as you'll recall, the last 5 days are not completely updated, so they can only go up from here as the data from the tests come in. So it's already looking like a pretty sharp increase there, and we expect those numbers to go up. So we just quite are not quite keeping up here with vaccination compared to cases, particularly in specific areas of the county. And so we will likely, unfortunately, experience some hot spots in our area. We seem to have all the makings for that scenario. Currently, the zip code that has both the lowest vaccination rate and the highest 28-day case rate is the 94605 zip code, and that is a rather new development. This is still an East Oakland zip code, but is not the one that we have been reporting on for month over month over month here, where it was 94601, 621, and 603. Now we are seeing the 94605 being of concern with both low vaccination rates and the highest 28-day case rates. And so we will be keeping an eye on that. And now I'm going to pass it over to my special guest, Analena from Streetwyze, who is one of Roots Community Health Center's partners. Analena?
Hi, I'm Annalena Hope from Streetwise, and we want to pay you to share your stories around health justice. Why? Because Black and Brown communities have a long history of not being treated fairly by healthcare systems and not having our voices heard. And we are reaching out to you to help us change that. We want to center community voices. We want to move Black and Brown communities from the margins to the epicenter of health and well-being. We want to help Black and Brown communities move from surviving to thriving. Streetwyze is a community mapping tool that helps everyday people find important resources in the Bay Area and share what's really going on in their neighborhoods in terms of the things they like, don't like, and where they want to see improvements. Streetwyze is partnering with Roots and UCSF to pay community members up to $50 in e-gift cards to share your story about how you are experiencing the COVID pandemic. We want to know how COVID has impacted your life. What resources have helped you during the pandemic, and what support do you need? Our goal is to center community voice and share lessons learned with the Roots Clinic to improve how we support Black and Brown communities recovering from the pandemic. We know you are the expert in your community. Nobody knows the neighborhood better than you, so we want to hear from you. We're offering up to $50 in e-gift cards for joining Streetwyze and posting your COVID stories and/or completing short surveys. Our project is open to anyone who's over 18, speaks English or Spanish, has access to a smartphone or computer, and lives in Alameda, Contra Costa, or San Francisco County. If you're interested in participating, please contact us at projects@streetwyze.com or text us at 510-473-5711. We hope that you will join our movement to build healthy, thriving, people-powered communities from the ground up. Thank you.
Thank you for that, Analena. Now, in closing, let us remember our layers of protection. And at this point in time, the vaccine is the only layer of protection that at this point is helping to drive down those transmission rates and get this pandemic under control. And it appears that the vaccine is the only way we get out of this pandemic. And so, vaccination for all those 12 and up. masking and distancing is still important, particularly when you are around those whose vaccination status you do not know. If you get symptoms, please get tested right away. And this is whether or not you are vaccinated, because we want to not only protect you, but also those around you. And we want you to act quickly, in particular because you may be eligible for a life-saving treatment, but it must be begun in the early stages of the infection. So please get tested immediately if you get symptoms. And remember that symptoms can look a little bit different with this Delta variant, and they can also look a little bit different post vaccine. So if you've got a runny nose, if you are sneezing, if you've got a sore throat, these are all symptoms that we are seeing post vaccine. These are also symptoms that we are seeing disproportionately with the Delta variant. And the other thing is that the loss of taste and smell, those were pretty much for sure symptoms that you have COVID-19, because we don't see them in other viruses. However, with the Delta variant, we are seeing the loss of taste and smell a little bit less than we were seeing with the wild type. So don't think that just because you have not experienced loss of taste or smell that you don't have COVID. The way you'll know is to get tested as soon as you have symptoms. So please keep that in mind. And if you were exposed, please get tested in 4 to 8 days. And this is particularly if you are unvaccinated or if it is required for your work or school situation. And for indoor spaces, we'd like you to avoid crowded indoor spaces, especially with people whose vaccination status you do not know. Make sure that you've got good ventilation if you must be inside, and that you're also not spending a long duration of time, because these are all things that put you at higher risk of contracting COVID, particularly now that we're dealing with such a much more contagious variety. Filtration is important if you are relying on a HVAC system, and so you'll need a MERV 13 or higher filter or a HEPA filter. And disinfection and sanitization is still important, especially of your high-touch surfaces, and make sure you wash your hands and don't touch your face. If you have chronic medical conditions or you haven't been checked out for them in a while, please reach out to your primary care doctor. Get that blood pressure checked, your sugar, cholesterol checked. Do what you can to stay in tip-top shape. Keep up good nutrition and physical activity. Take a multivitamin and additional vitamin D supplementation. Manage your stress and get a good night's sleep. This concludes today's People's Health Briefing. Thank you for joining us. We look forward to seeing you next Tuesday at 10 a.m.